was clear in his speech, I shall try to clarify a few issues or a few details that have been raised across the country. First and foremost, as you are aware, the head of state, on advice by the National Emergency Response Committee on Coronavirus, vacated the dusk to dawn curfew that we have been having for the last 1 year. The curfew is one of the measures that was introduced with the aim of curtailing the spread of the virus. I'm sure that many of you will attest to the fact that it has helped a great deal in that regard. Secondly, there have been issues raised as to what happens with regard to the closure of bars at 7 p.m. that had equally been announced by His Excellency the President in his previous address. With the removal of the curfew next week, what happens? This is the way it is. With the removal, we are reverting to closure of bars and restaurants at 11 p.m. or the time allowed by the licensing authorities. Protocols on hand washing, social distancing, sanitizing, however, remain in force. This means that all facilities will still be expected to have hand washing posts and abide by the seating capacity as per the set protocols. I therefore appeal to county governments and enforcement agencies to ensure that the licensed facilities abide very strictly by their licensing conditions, while county public health officers ensure that sanitary and other health conditions are met at all times. And these sanitary conditions include not just what we have set forth as far as COVID-19 protocols are concerned, but as set forth even previously on health grounds. For example, the sanitary facilities in restaurants, in meat-eating facilities, in all areas that there is consumption of any sort of food must be met, including cleanliness of toilets and so on and so forth. This is a condition that must be met for bars to continue. And we have directed that where those are not met, then the situation must be addressed within the law and what the law says, including the closure of those institutions. On a different note, there's also been issues raised about night travel and with regard to public service vehicles. In the same way that the ministry has developed protocols in collaboration with the stakeholders in the hospitality sector, we have done the same with the transport sector. I am aware that the Ministry of Transport is seized of this matter, and we will be appraising you in the shortest possible time. Fellow Kenyans, we are continuing with our plans to accelerate our vaccination program to ensure that we can contain and sustain what the President announced yesterday, including the ability for us to continue with the curfew as it is, the opening, the cessation of use of the curfew is also dependent on how well we are able to move forward as far as vaccination is concerned and the health protocols. You are all aware that there are many countries that have done exactly the same, opened up, and very quickly reverted back to the protocols that were there before as a result of the resumption of high levels of virus infections. This, we hope, is not going to happen to us, because we want to very quickly wrap up our vaccination rate and get as many people as possible. And I wish to state that the vaccination supply situation in the country, the vaccine supply situation, has now been greatly improved. In the next 2 weeks, we shall have received and supplied all doses required for us to receive our target of 10 million people by December. Later this evening, in fact, we shall be receiving an additional 500,000 Johnson & Johnson vaccines through the AVAT mechanism to bolster our efforts. We also hope to receive even more vaccines over the next few days and weeks through different mechanisms. With this improved supply, our focus now is getting the vaccines into as many arms as possible within the shortest time possible. Our appeal, therefore, is to all those who are eligible for vaccination to turn up at vaccination posts or at outreach venues. The reduced positivity rates does not mean that the pandemic is over and that there will be no other wave. Nothing is farther from the truth. It's very easy to have the situation get out of hand and rise in infections again. I therefore want to once again appeal to Kenyans not to relent and ensure that they get vaccinated. I appeal to younger people to ensure that their parents are vaccinated and to urge them to do so and to make arrangements for them to do so. This is the best way of ensuring that you are taking care of your parents at the moment. As you are aware, 2 of the vaccines that we are using, that is Pfizer and Moderna, once removed from the freezers, must be used within 30 days, which means that they have a short shelf life once they are put to use. As we have guided in the past, health workers must plan and work very closely with the teams conducting community mobilization to ensure that we do not have any vaccine wastages. We have worked very, very hard to ensure that those vaccines benefit Kenyans and our overall COVID-19 response. Counties with low uptake must be prepared to share those doses with those that have mobilized their communities. We want to ensure that that target by December of 10 million persons have been met. As His Excellency, the President also announced yesterday, the government has formed the Kenya Biovax Limited, a company that is now mandated to establish the manufacture of human vaccines in the country, starting in the initial stages with the fill and finish plant for COVID-19 vaccines. I am also happy now to report that indeed a multi-agency technical team, which has been working on the project, has laid out a roadmap that will ensure the fill and finish plant is operational as was directed by His Excellency the President. I am also happy to report that the physical location for the project has been identified and you'll be in the go-downs of KEMSA at Embakasi. Finally, as infections rate remains low and we begin to reopen, let's ensure that we behave responsibly using the lessons that we have learned in our fight against the disease so far. We will not tire of reminding our people, our citizens, that social distancing remains important. I have literally noticed that people are beginning to stretch their hands to greet others. Don't take the stretched hand. Just tell him, Yatosha. Just tell him Yatosha, because that is the beginning of indiscipline. The idea of social distancing remains important for us. So please, even as we are culturally oriented towards handshakes and such other good behavior, as it were, in the past, we have not reverted to physical contact of any kind, such as shaking hands, hugging, kissing, and so on and so forth. So let's please keep our masks on and keep on sanitizing as we use these as the main weapons against the disease. I thank you, ladies and gentlemen. Any clarification? I think we have said enough, but if anybody wants further clarification. Yes, Purity? Is it Purity? Yes. Huh? Oh, it's Helen, sorry. Nasibo, any question?
Helen Aura from NTV. Just a clarification on the vaccine drive. Can you hear me?
Helen, you have to speak. I think it's not you, it's the mic.
Oh, right. Okay. Just a clarification on vaccination. So the fact that Kenya is vaccinating between working hours, does this mean that now vaccination within public health facilities will be extended to hours outside the normal working hours, and as well as vaccination exercise within private hospitals as well, so they're not restricted within the normal Monday to Friday working days as well as to the weekends now?
Good point. Very good point.
Mutahi Kagwe from Citizen TV. From the figures that have been released by the ministry on the status of the vaccination program, some of the counties that are being ranked as the lowest appear to be counties that are pastoralist related and those in sort of far-flung areas. Is the ministry possibly doing something to ensure they reach out, maybe specific targeted programs for the pastoralist communities, because we know many are moving now in search of pasture and food for their livestock?
Saada Hassan from KTN. I have 3 questions. So the first one is the proposed BioVax Limited. Is the cost that will go into establishing this facility part of the taxpayers' money, or this is where are we getting the funds to build this facility? The second question is, what is the status of the Delta variant in Kenya? Because at some point it was increasing. Where are we right now? And the third one is a clarification on the seating arrangement. Are we going back to 1 meter distance, or we can continue with our lives the way it has been the last 1 month?
Saada, you are ambitious. Okay. I will start. Let me start with Saada's question. Saada Hassan's question regarding BioVax and taxpayers' money. Am I on? And taxpayers' money. Saada, that is the only money there is. You know, that is the only money that there usually is. Taxpayers' money, everything in Kenya money is actually taxpayers' money. And yes, that is the taxpayers' money that is going to be used. Some 2 billion has already been set aside for that purpose by the cabinet, and we haven't used it yet because we are still doing the preliminary works. But essentially, that money is supposed to be for buying the equipment itself. You know, the form and feel is a sophisticated and complicated equipment that does not currently exist in our nation, and this is something that they have to order in terms of what they have determined themselves. So 2 things are happening. Number 1 is that they have to get the technical details completely correct and then order the manufacture of the machine. So yes, it is the Kenya government that is doing this. And I think that given the experience we have had in the last 1 year and the danger of dependency on other countries for vaccines, it's pretty obvious that this is an investment that should have been made a long time ago. And as I've often said, you are aware that we do make animal vaccines in Kevavapi. But why we don't make human vaccines is a strange phenomenon. I mean, I know we love our cows, but we still need vaccines as well. On the issue of Shemtai's question regarding the pastoralists, you see, the long and short of it is that each county government must structure the way that they are going to vaccinate their people in accordance with how the people in the placing and the population dynamics of those counties. As a whole, the Ministry of Health is on standby to do everything it can to support every county. For instance, in the counties that you are alluding to, we have asked even the Kenya Red Cross to be part of that process. We have asked AMREF to be part of that process so that we can ensure that we reach as many people as possible. The only advantage that we have in those situations is that also the infection rate is also fairly low in some of the areas that, that you have mentioned. But the idea is that every county should be acting swiftly, using mobile facilities if necessary, adapting to the situation that their citizens present to them, and therefore vaccinating just like anywhere else. On the issue, and of course, it is true that at the moment there's a lot of movement because of in search of pasture in most places. But we must therefore follow the pastoralists to ensure that we vaccinate them wherever they are. Helen, on the issue of the vaccinations and the private hospitals are currently already vaccinating people. But to your point, the issue of vaccinating beyond working hours, so that people, for instance, in the evening after work, can be able to go for vaccinating places, is a point well taken. And we are going to ensure that we keep the facilities open, at least for some hours after working hours, so that we are able to vaccinate them, and that's a good point. So, ladies and gentlemen, I once again want to thank you. Please, members of the Fourth Estate, assist us, as you have done in the past, by ensuring that you publicize the matter. You make sure that we are urging our parents and everybody else to get vaccinated. We have enough vaccines. We were desperate for vaccines. We have enough vaccines now. And I want to ask Amos to respond to the question that was also raised regarding the details of the virus.
Thanks, Wakili. In addition to the question asked by Mutahi about the ASAL areas, with your kind permission, I could just highlight a little bit. Of course, you know the challenges with ASAL counties like Marsabit, Turkana, Wajir, Mandera. One is the vastness. Number two, of course, is the number of health facilities in terms of the geographical distance, and of course the various health-seeking behavior of that particular community. And in addition to what Waziri has said, you are working with the counties to be able to develop micro plans with these particular counties to target specific segments of the population for outreach vaccination activities, and also mapping out the various partners that Waziri has talked about, Red Cross, AMREF, World Food Program. And even though we are facing a drought situation, again, this is a big opportunity, because when the Ministry of ASAL is distributing food with the World Food Program, Red Cross, AMREF, again, that is a big opportunity for us to be able to plug in and use that as a latitude to also be able to offer the vaccines in that same platform. So we are going to use this challenge as an opportunity to be able to ramp up vaccination in those countries. And we are glad to report that all counties now have developed their micro plans, which are very, very sharp documents detailing who is eligible, where are they located, and what is the best approach to be able to reach them. In terms of the variant in circulation, still the main variant in circulation is the Delta variant, the numbers coming down notwithstanding. But as at now, we are in a better position, though we still need to remain vigilant. And of course, we'll continue with our vigilance in terms of serosurveillance and doing genomic sequencing of specific samples to be able to tell us. You remember, like the UK, the progress that they have made in their vaccination, but you see the situation they are now grappling with. Now we have a sub-variant of the Delta variant, and that is one thing that we are really keenly looking at, because it can easily disrupt our vaccination program. So surveillance will continue through the ports of entry, and we are ramping up our ability to be able to do genomic sequencing to be able to tell us. But as for now, Delta variant is the main variant that is driving the transmission, but our numbers are now very, very low. But as Waziri has said, we should not lose, we should not drop the ball, continue to maintain the non-pharmaceutical interventions, which we think is what is making Britain falter, because they assume that once you are vaccinated, you don't require the masks. For us, we'll vaccinate and maintain the other public health measures. Thank you.
I think the only final thing to add on, Saad, I don't know whether your question, sorry? Yes, I was going to come to that. Finally, is the issue of the conferences and general sitting arrangements that that I also think is worth clarifying. For example, the Council of Governors has now organized the resumption of the meeting that they usually have, which is supposed to be in Makueni. And also the issue of how to structure those gatherings. The advice that we have is that we still maintain low numbers in all the meetings. We have said that the Interfaith Council has met and is meeting to discuss the matter on their own, as we have done in the past, but we have recommended that they can increase from 1/3 to 2/3, depending on the size of the sanctuary that is being used. But that applies also to other institutions. For example, if it is conferences that are being planned, there are two critical things to remember if you are planning on any meeting. Number one is the 2/3, as we have said. Number two is ensuring the best way of protecting those in the meeting. For example, the Council of Governors meeting is to ensure that everybody, bar none, who is going to be in that conference presents a vaccination certificate. If everybody in the conference, including those serving food, including those attending the conference, anybody, observers, attendees, etc., if everybody has been vaccinated, then the chances of starting another wave from that center is minimized substantially. So my advice is when it comes to the bars, when it comes to the restaurants, the sitting arrangements are those ones that are in place at the moment. The sitting arrangements are still the same, and therefore, while we have said you can continue in terms of the time, the sitting arrangements remain the same. And I really want to appeal to everybody to cooperate in this matter, because it is the only way we are going to keep the places open as we would wish to. Thank you all very much indeed. Have a nice day.
This issue of sporting facilities, the stadiums and the other places.
The same applies to the stadiums, and in fact, we are very happy with what we have seen with the sporting fraternity. I think, in fact, they are ahead of us, and I want to thank the Ministry of Sports and my colleague C.S. Amina, because they have really been ahead of us when it comes to sporting facilities, ensuring that every participant, all persons coming into the country for sporting activities are fully vaccinated. We ensure that we want to ensure that moving forward that is the case, but not just those coming into the country. We also want to make sure that those participating in the country are also fully vaccinated, and we want to ensure that those sitting in the bleachers are also either vaccinated or tested for negative results. So with those kind of measures, we are sure that we can continue opening up our nation. Asanteni. I didn't hear what he said. I'm being asked about the directive that people work from home. I think one of the